Well, I often have family or friends say to me, if I ever get cancer, I'm not doing any of that chemo stuff. And I say, well, if you ever get cancer, you better talk to me before you ever decide that you're going to do nothing. Because it used to be 20 years ago, even as I was starting to train and finishing some of my training, that chemotherapy and surgery and radiation, first of all, those techniques weren't as good as they are now, but also those were really some of the only options that we had for people. But in the last 20 years, there's just been an explosion of different types of treatment for cancer. And so we've really gotten away from chemotherapy in multiple diseases. For example, in breast cancer, we used to give all young women chemotherapy. And now we know, based on molecular testing of the tumor itself, that a lot of those women do not need chemotherapy. So we're avoiding chemo in a lot of situations that we didn't know before, that the patient was so low risk, they didn't even need the chemotherapy. So a lot of women come to us now, and I'm able to say, you're not going to even need chemotherapy, to which there's, of course, a rush of relief and tears sometimes. But also I would say in breast cancer, but in other diseases, the research has focused a lot more on targeted treatments, so targeted towards certain mutations. Immunotherapy has absolutely changed the entire game of cancer. For the last several years, we've had drugs that are the total opposite of chemotherapy. These are drugs that boost the body's immune system and help the immune system to fight the cancer off. And diseases like melanoma and kidney cancer that we previously had very few treatments for now have long-term remissions. We're even using the cure word in some people that had stage 4 disease because we just can't even believe the responses we're getting with immunotherapy. And more importantly than that, with immunotherapy, people's quality of life is so good. We have older patients on immunotherapy in their 80s and 90s, and you would not even know that they are on treatment. So there are side effects with some of those drugs, and there's a lot of education that goes into telling our patients what they can expect when they take those treatments. But a lot of people are living longer and longer. And so I was just talking to a colleague last week from Houston. We were saying, isn't it just the most exciting thing you can believe that we've got all these people that are living so long? It gives us such joy, but we're so surprised because we both trained about 15, 20 years ago, and we never would have thought in our lifetime that we would have been able to provide this kind of care for people. So it's been really, really exciting.